My name is Kristin, and I am a patient of Dr. Kaufman. I'm 26 years old. I'm from Little Rock, Arkansas. I started seeing Dr. Kaufman after a surgery for thoracic outlet syndrome went wrong and left my phrenic nerve paralyzed. My symptoms started 3 days after my thoracic outlet syndrome surgery. So I couldn't take a deep breath, bend over, lay flat. I had a ton of trouble walking very far, like more than 5 minutes I couldn't really do. I had a lot of trouble going up and down stairs, and eating became very difficult because having food in my stomach made it harder to breathe, which caused a lot of stomach problems. And I also had chronic hiccups that I would get like 3 to 4 times a day. Even though my symptoms started 3 days after my surgery, it took about 6 weeks to actually get diagnosed with paralyzed diaphragm. After a pulmonologist had told me that there were no options for me other than diaphragm amplification, and that I would be disabled for the rest of my life, I Googled other solutions, and I saw Dr. Kaufman's research papers. I read them all and decided to contact him. And it was kind of scary, but getting such a rare surgery that so few people have had. But I decided that the alternative was being permanently disabled, and so I thought it was worth it to go for it. So I did a telehealth with him pretty soon after reaching out. I would say within a couple weeks. It was a pretty quick turnaround between contacting him and being able to do the telehealth visit. And he listened to all my symptoms, decided I would be a good candidate for surgery, and within, I think, a few months later, I was flying to New Jersey for the surgery. I got the surgery. It was pretty quick and easy, about a day in the hospital, and then I stayed for another week to recover and follow up with Dr. Kaufman. My recovery was super easy, which was kind of unexpected. I think because I got the surgery so soon after my injury, it allowed for a quicker recovery. Immediately upon waking up from surgery, I could breathe better. And before the surgery, on an incentive spirometer, I was blowing like 500, and 3 days later I was blowing 1750. And the reaction in the office was kind of crazy. They were like, wow, this is really impressive progress. My life has really gone back mostly to normal. I was able to start working again. I was able to start socializing a lot more, leaving the house. I feel really relieved that every conversation I have isn't about my health. So it's really nice to kind of have my life back. I had an extremely positive experience with Dr. Kaufman and the staff. Everyone was so kind, and I can tell that he and the people who work for the clinic genuinely care about the patients and love what they do. I would encourage anyone with diaphragm paralysis to reach out to Dr. Kaufman and see if they're a good candidate for the surgery. I would also encourage them to look up his research papers that have been peer-reviewed and published. Read through them, see the results for yourself. Check with your insurance company, see if this is something they would cover, like mine agreed to cover. And if so, I say go for it. The surgery totally turned my life around. And, even though I had other doctors who had never heard of this surgery and immediately wrote it off and weren't even willing to look into it and telling me not to do it, I decided I had nothing to lose. I couldn't breathe, and I was staring down the barrel of being permanently disabled. And after talking to Dr. Kaufman about the risks, the biggest risk was that it wouldn't work. So I figured it was worth it to try. And I'm really, really glad that I went through with it. I was told at 25 that I'd be permanently disabled, and here I am at 26 doing better than I was before my injury.